We'll just go through some quick administrative items, and then we will go ahead and get started. You are all coming in on mute like you usually do. If this is the first time you have joined us for this call, welcome. We're glad to have you. We do record these calls and we do post them on our Confluence, and those are typically available within 2 business days of our meetings. So if you have to drop off or if your audio gives you any issues, you can always go back to the recording and the materials. If you have questions or comments, and there will be probably several things you may want to comment on during this call, you can use your chat feature, and please send your chats to everyone. There's a little pull down there so that we can all track them behind the scenes and try to address some of your comments during the call. Next slide, please. If you have not already done so, please join the project. This is how we reach out to you all with emails and calendar updates. If you need to check and see if you are currently a registered member, you can use this link to go to the Confluence and check the member list. And if you need any other project information, all of it can be found on our Gravity Project Confluence. Next slide, please. We would love to thank our project founders and our in-kind support organizations. They are all here on this screen. We can't do this work without you. And we deeply appreciate the commitments and the support that you are giving us, and we hope that we can continue to move forward and put all of this to good use. If you are interested in becoming a sponsor, you can email gravityproject@emiadvisors.net, or you can visit our Confluence, and there's a big blue button on the home page if you're interested in sponsoring. Next slide, please. We have a lot to go through today, so I'm going to start talking really fast so I can hand the call over to Sarah DeSilvi and our housing leads, but we will go through some quick introductions and announcements. We'll look at our project roadmap and upcoming schedule, which I'm sure you all are aware is going to need to bend a little bit due to the situation that we have currently with COVID-19. We will go through the housing domain approach and concepts. This is our housing domain kickoff call. We will go through housing instability and homelessness, those data element submission statuses. We will go through Gravity Project Data Principles updates. This is something that we covered in February, and we have updates for you. And then Lisa Nelson will take you through the FHIR IG updates to date, and then we will go through some homework and some next steps for our next call that will be in 2 weeks. Next slide, please. Our housing domain leads, I am happy to introduce Megan Sandel, Allison Bovell-Ammon, and Rich Sheward. Allison and Rich are with us today on the call. Megan was not able to join us, but they will be your fearless housing domain leaders, in addition to Sarah DeSilvi, who you probably remember from Food Insecurity, and we will let them walk you through the new housing domain concepts and information here in just a few minutes. Next slide, please. We do have a new calendar invitation series. If you have a calendar invitation in your calendar that is not called Gravity Project Community Collaborative Meeting, you have an old invitation. And we are updating these invitations through our Google group now. If you are a registered member of the project, you have received a Google group invitation and have probably responded to it and have the correct invitation. However, if it is not called Gravity Project Community Collaborative Meeting, if it says weekly something or biweekly something, we ask that you delete it and email gravityproject@emiadvisors.net for the updated version, so that you always have the latest version of the calendar invitation and don't think that you're missing a meeting when you're not. Next slide, please. We would also like to share that the HIMSS 2020 Gravity Project, the virtual presentation that we gave on March 11th has been posted. It is on our Confluence. You can see the recording and the meeting materials on our past meeting materials page, and it's dated 11 March 20. And again, you can get those right through our Confluence space. Next slide, please. This is our schedule. We had proposed this several weeks ago, actually a couple of months ago, as you are all aware if you joined us in February. And it's aggressive to start with, but we realize that in the face of a pandemic and the fact that many of our stakeholders are currently on the front lines and you are swamped and juggling many plates, we are probably going to need to push this. We don't know how far out yet. We're going to try to be flexible and play it by ear, but we want you to be aware, especially for the deadline for housing data element concept submissions, we will most likely push this out. We don't know how far yet, but if you are feeling terrible because you have not had a chance to breathe, please don't. We know what you're doing. We're in the trenches with you. Yeah, all of our colleagues are in this together. So please don't feel like you have to scramble to meet that deadline. We will keep you updated as to when we think it's reasonable to ask for those submissions by. But for today, just know that you have a lot of wiggle room. There's a lot of forgiveness here, and it's going to be day by day, week by week, until we can get through what everybody's going through right now and come out the other side, hopefully. So just for your awareness. And then if you want to go to the next slide, Evelyn, this is our snapshot roadmap. We're here at the end of Q1, and we are kicking off the housing data set identification. And again, this timeline is highly subject to change. So when those deadlines get pushed out, this timeline will also change. This roadmap will change globally for the housing domain work. Next slide, please. At this point, we have a question for the community. We will ask for your feedback via email, or you can put it in the chat while we talk today if you just have some immediate thoughts, because we do save the chats, and we can revisit those and address your comments later. But at this time, I wanted to find out, Caroline, are you able to speak to this a little bit? Caroline Fichtenberg is our Siren sponsor. I'm going to unmute you. There you go. And if you can kind of share, hi, Caroline.
Hi, everybody.
For jumping on. I didn't mean to put you on the spot.
No, this is great. I'm sure that everybody here's brain is really very COVID focused right now. And so we are trying to think about how to make sure that we are thinking as much as possible about how this work can be useful either in the present moment or certainly in the future. So we are just wondering if you might chat in or send an email that lets us know, what are you seeing in your settings that help make a case for the need for interoperable social determinants of health data right now? From our vantage point, we are hearing about a few different things that are ways in which a lot of different ways in which this crisis is highlighting the importance of knowing things like housing instability, food insecurity, all things that we are working on with the Gravity Project. If we had all this information already in place, I think that it would be used right now in many different ways. So we're really interested in kind of basically developing use cases for this data for this kind of a crisis. So feel free to chat in anything that you're noticing, thinking about, or email it to us, and we'll be kind of putting it together as part of the Gravity material. That is it. Thank you so much. I'm already seeing something coming in.
Yes, and we love our community comments, so feel free to chat us. And if you have more extensive thoughts, please do email us at gravityproject@emiadvisors. That should be .net, not .com, but hopefully it will get to us either way. Evelyn, was there anything you wanted to add before we move forward to the housing domain concept?
No, thank you, Lynette. Let's move on. We have a lot of content.
Okay.
Thanks.
Yes, we do. We do. At this point, I would like to reintroduce Sarah and to introduce Rich and Allison, and I will let you all take it away from here.
This is Sarah. I'm happy to yield the floor to my friends and colleagues, Allison and Rich, who are going to take over talking about the background of housing, similarly to how I did with food insecurity way back, dog's ages ago. I'll come back in and discuss homework and next steps. And next time we visit, we'll be talking about the HMIS work group. But we have a lot to cover today. So Allison and Rich, here you go.
Okay, thank you so much, Sarah. Good afternoon, everyone. So to sort of kick things off, we thought it would be helpful to provide a little bit of contextual information about housing instability as it relates, in some cases, to other social determinants, using food insecurity as an example, because Gravity Project just sort of wrapped up its food insecurity work. So in terms of the housing domain, there, unfortunately, is no agreed upon singular definition of what housing instability or housing insecurity, homelessness actually is. Allison will describe that in more detail in a minute, but there's no single definition. And related to that, there's no gold standard for measuring what would be considered unstable housing or housing insecurity and homelessness. Again, we'll speak to that as well. Comparing this to food insecurity, there is an agreed upon definition of what constitutes food insecurity and a gold standard way of measuring that, the USDA Household Food Security Survey module, the 18-item questionnaire. There is no sort of HUD equivalent of that. So this makes the work of the Gravity Project and the housing domain a little challenging. And that is not at all to discount the really decades of research that has gone into housing, different social risks and housing circumstances such as quality and affordability. There's a lot of great research out there, but investments in future research, especially around understanding the best way to identify those who are experiencing housing instability, homelessness, is certainly warranted. Next slide, please. And one sort of straightforward or easy way to understand at least our sort of conception of conceptual model of housing instability is sort of like an iceberg, where what we see on the surface and what is really apparent is homelessness. That's relatively straightforward. It's what's under the surface that can be a bit uncertain and murky. What we define as housing instability, in addition to homelessness, are a few other circumstances. And we'll talk more about this in a second, but we're talking about behind on rent or mortgage, or experiencing multiple moves within the context of the past 12 months. And even beneath that are centuries of inequitable policies, discrimination, racism, affordability issues, and so on and so forth. And so all of that sort of feeds into what we see on the surface. Next slide, please. I'm going to turn this slide over to Allison, who's going to explain a little bit about the breadth of research on homelessness, how it's defined as well.
Thanks, Rich. So as Rich mentioned sort of on the first slide, there's no agreed upon definition of housing instability or insecurity, but there's also really not a set definition of homelessness, even when it comes to our federal statutes. So this is just an example. The U.S. Department of Housing and Urban Development, or HUD, has a specific definition of literal homelessness that includes the items here that you see on your screen, not having a fixed or regular place nighttime residence, sleeping in a place not known for human habitation, or a shelter. But then when you look at the statute under the McKinney-Vento Act, which is really applying to children and youth, includes other settings around shelter and not staying in places not meant for human habitation, but it also applies to children and youth sleeping and sharing housing of other persons due to a loss of housing or economic hardship or other similar reasons. So again, we bring this up to just illustrate the nuances and even just thinking about one of the domains of housing instability and homelessness, and that is homelessness. Next slide.
Guys, could I make a quick point
Yes.
to this while we're on? This is Eric Yan. I'm a consultant for HUD with the Homeless Management Information System. I do not represent HUD. I work on their HUD XML schema format typically, and I am also a vendor in the space, so I have different, allegiances, but I'm not a representative of HUD. I just want to point out, McKinney-Vento also funds the HUD HUD Housing and Urban Development. In other words, that act is the enabling legislation, I believe, for HMIS. So it's not like education is McKinney-Vento and HUD is another. They're both McKinney-Vento to some extent.
Thanks for that clarification, Eric.
The other clarification I want to make is, and I'm just pointing out some things that are coming up in my mind, just because I want to help you guys, suss out the differences and the different definitions. It is true. It is recognized that the Department of Education has a different definition than HUD. I do think that the USICH, the Interagency Council on Homelessness, would be like I believe that's where the definition is the most broadly defined on an interagency level. Those are the only 2 points I wanted to make. Thanks for allowing me to interject there.
Thanks for that, Eric. So just moving on to the next slide, there is a robust amount of research around homelessness and health. I did not even begin to attempt to fill a slide deck with all of the studies that have looked at this topic across the lifespan from the prenatal period through adulthood. But suffice it to say, there is robust research connecting homelessness and adverse health outcomes across the lifespan. The next slide. So I'll throw it back to Rich to talk a little bit more around how we began to move in our research from just thinking about homelessness and the impact on health to other forms of housing instability.
Thanks, Allison. So for those who are not familiar with Children's Health Watch is a multi-site research and policy group headquartered in Boston at Boston Medical Center, also collecting data in 4 other safety net hospitals in Philadelphia, Baltimore, Little Rock, and Minneapolis. We, since 1998, have been interviewing families with young children under the age of 4 who present for care either at the pediatric emergency department or pediatric clinic in these 5 cities. And in those 21 years, we've collected just over 70,000 interviews, and we've been understanding the connection between economic hardships and health-related social risks such as food insecurity and housing instability and energy insecurity, and children and their caregivers' health and health outcomes. Just to set what I'm about to describe, our 2018 study that was published in the journal Pediatrics, we looked at in our data set among the 22,000 families that we interviewed, understanding those that experienced a series of adverse housing circumstances. We asked about being behind on rent. We asked about moving multiple times, living in 3 or more places, so experiencing 3 or more moves in the past 12 months, or a history of homelessness in that child's lifetime. And we found that among the sample, just over a third experienced at least one of these 3 adverse housing circumstances. And each of these circumstances is individually associated with adverse health and material hardships compared to those families that experienced none of these circumstances, what we called were stably housed. We'll go to the next slide, please. We're happy to follow up with the link to this article for those who are interested in reading it. So again, there was a 34% of families experienced at least one of these. And for those that did experience one of the adverse housing conditions, we found that there was actually very little overlap among them. So if you were a family that had been behind on rent in the past year, the majority only experienced that one circumstance versus having also experienced multiple moves or multiple moves and homelessness in that child's lifetime. So what we're finding is that we're catching different groups that are experiencing different circumstances. Next slide, please. And again, to my previous point, we found that each of these circumstances was significantly associated with adverse child, adverse maternal health outcomes, as well as associations with other health-related social risks. And as you can see here, it's not that one sort of is more important than the other. They're all getting at different things. And in some cases, families that are experiencing being behind on rent actually look just as bad, or in some cases worse, than those who've experienced homelessness, which initially seems like it's a more severe housing circumstance. And so we feel that there's a need not just to look at homelessness, but to look at some of these other circumstances that are catching different populations and having significantly associated risk factors. Go to the next slide, please. And I do want to acknowledge some limitations of this research. So it, the population that we're studying, it's mainly majority low-income families with young children, limited to the 5 cities that we operate in. And so there is the need to replicate and look at this among other populations, just adults as well as the general population. Because there was no gold standard to compare this to or validate this measure against, that's problematic. For those familiar with Children's Health Watch, you might be aware that Children's Health Watch in 2010 validated the 2-item food insecurity screening tool, commonly referred to as the hunger vital sign. And for that effort, we were lucky enough to use the USDA Household Food Security Survey module as a gold standard to validate the hunger vital sign. We did not have a tool at our disposal to validate against. So what we did was we examined the relationship between these housing circumstances and the health and hardship outcomes. We found that they were significantly associated with each other. That's undeniable, but there's more work that can be done. This is not the sort of be-all, end-all of understanding and identifying housing instability. There are other questionnaires, other tools out there, and I think part of this effort is to consider everything at our disposal. This is one example that we wanted to share with you all today. Go to the next slide. And here I'll turn it back over to Allison.
Yeah, sure. So, we acknowledge that in this effort and on this housing kickoff call, that there are other domains of housing that are strongly linked with adverse health outcomes. I saw someone wrote a note about environmental hazards. So unsafe and substandard housing, as we know, has strong and significant linkages to adverse health outcomes, as does a really growing and emerging body of evidence around neighborhood level indicators. While we acknowledge that these are really important factors, we've sort of just come to an agreement that is currently out of the scope of this project, that given the sort of breadth of what could be taken on at this juncture, we are hoping to focus on the domains of housing instability and homelessness. But we do recognize that further work, future work, needs to be done to address these other housing-related factors that impact health.
Great. Thank you very much, Allison. This is Evelyn. I'm going to pause right now. We're going to open it up for questions. Lovely to see all the questions being posed. We can go through the chat first or open it up. Any questions right now? Okay, maybe we'll just address, yes, please go ahead.
Hi, this is Lucy Johns. I just put a question in the chat. Maybe some people can't see it, so I'm just going to read it. Eviction. Is this a customary statistic to collect for SDOH health assessment? Corona crisis reveals that prohibiting eviction is perceived as critical government intervention based on protecting health. I'm trying to connect this policy to what we're talking about.
Thank you, Lucy. Housing leads, any response?
Yeah, Lucy, I think that you raised an excellent point, and there certainly is a lot of information about the connection to eviction to health. I think when we were thinking about sort of forms of housing instability, while people may be evicted for a number of issues, you know, most people are evicted because of inability to afford rent. And so that was one of the pieces that we were looking at with families falling behind on rent, and saw that as a predictor of adverse health outcomes. There are other questions and other social determinants of health screening tools that ask about risk of losing someone's housing, so it sort of gets at some of these eviction or foreclosure questions that you're raising as well here. And so I definitely think that this is an area that is, you know, open for discussion within this. It certainly fits within the housing instability domain. I think the question is where do we think about sort of the cutoff point for that question?
Well, I would just reply briefly to that inability to pay rent is unquestionably a predictor for eviction. But for those of us living in or experiencing extreme, fast-paced gentrification, inability to pay rent is not often, or not as often, a predictor. Is simply a private market pressure permitted under law that can affect a lot of people whom you wouldn't think would have housing stability, but are suddenly facing it. So I think it's wonderful that all this research has been done for a very long time, and certainly kudos to Boston City Hospital, which has been addressing social determinants for decades. But I guess I'm trying to convey that there's another dimension now to eviction, which may affect people who might not be using a Boston City Hospital or a local equivalent, but they're still facing potential homelessness because of other forces acting to encourage and not punish eviction.
This is Sarah DeSilva. Can I step in for a second? I just wanted to, so Lucy, you were always very clairvoyant about seeing some of the things that, like the many forces that are implicating and influencing the health of the people we're trying to take care of here. I do want to say that I think for the scope as it is right now is one that it's anticipating what we've learned from food insecurity, but there's a lot of other questions, as Allison mentioned in her details, that need to be considered in future work. I think the intersection between neighborhood and those kinds of forces that you're talking about with eviction are really, really important. And again, which is different than food insecurity, this is an emerging science. We don't have that gold standard tool. And so we're trying to shape kind of an initial language to describe an initial approach in this, and hopefully we'll, in implementation, we'll learn lessons and maybe can refine things in time.
That's great. Just put it in the parking lot. Thank you.
Look, you've learned our lingo. Well done.
Thank you.
Thank you.
So everyone, this is Evelyn, just to keep us moving. I know there are other questions, so we'll try to answer ourselves or bring them up during our next pause. So I'm just going to move us along for the next portion. So I believe, Sarah, this goes back to you.
I believe Linda's presenting this section.
Yeah, this is
Linda,
mine. Okay, thanks,
go
Evelyn.
ahead.
Okay, next slide. I want to just take a few minutes. I know we really have a lot of material to go through. Just to say this is going to be a standard section in all of our upcoming meetings where we review what we've received to date for data element submissions and how many have been reviewed in our disposition, so you get a sense of the kind of data we're gathering. We actually have 4 submissions, 3 external ones and 1 that's based from our housing leads and Sarah, and carryover from relevant data elements from the Food and Security Masters list that are still appropriate in the housing domain. So you can see there we're starting to build some statistics, and we'll fill this in as we go along based on the feedback and the information that you give us as you start to generate more submissions to us. Next slide, please. Just a reminder, the areas that we're looking at for the submission are whatever screening tools that are being used today. If you have established goals that address housing instability or homelessness needs, how you are arriving at or assessing or defining or developing diagnoses for this particular domain. And in the interventions, 2 key areas: what programs are you using as part of your base to help support patients that are either have housing instability or homelessness, along with definitions, and what kind of interventions are you using? Those are 2 key areas that we really want to be able to gather information about what's currently being used today. Next slide, please. So how to submit, there's 2 ways to submit. This link here allows you to go to our online tool and it will step you through each section to add whatever information that you want to add for your data elements in those 4 activity areas. Or you can download a template of a spreadsheet that we've created and fill it out and then just email it back to Gravity. We'll go over that activity when we do the homework. And as Lynette said earlier, submissions originally were due by April 3rd, but we're going to give you some latitude knowing that this is not your first priority. But as you have time, as you can think about the things that you want to submit to us, please start doing so. We'll take it pieces at a time too. So just whatever you can do to submit to us would be great. Next slide, please. And what we're doing now with the submissions that we received to date and what our SMEs are reviewing is we're building our initial master list. We hope to have that adjudicated master list, the first version, out within the next few days when we're ready to send out the information for the recording and the slides for this presentation. So you can use that list to see what we currently have and then determine if you want, if there are things that you're currently, concepts, data elements that you're currently using, let us know that. We'd like to know how many are using some of the existing ones. And if there's new things that you're doing that are not on the list, please, those are really crucial for you to submit to us as you can. Next slide, please. I think that's my last one, and we can turn it over. I believe, Mark, you're up next.
Great. Thanks so much. This is Mark Savage, and I just want to say on this housing domain kickoff, huge appreciation to our housing domain leads, Allison, Rich, Megan, and Sarah, for the next chapter in this amazing work. On the data justice principles, I covered this in greater depth last time, but in brief, Sarah and I were talking about stories we're hearing about people misusing health data, and wondering whether the Gravity Project should have a statement of principles about data justice and using social determinants for good and not misusing them. And so we turned to some work that I had led several years ago in California, and agreed that we should present them to the community. I did that on the last call, and I'll briefly summarize again. But what I heard on that call was a lot of appreciation for the idea and appreciation for having a comprehensive set of principles that the Gravity Project could use to guide its work going forward. So let's see where we are. Okay, so and the principles are posted in the Confluence site, and you basically have one principle on the benefits for personal health, improving individual health care and its quality, benefits for population health, so the collective good, communities and the public, inclusivity and equality, ensuring that all patients and consumers benefit fully and equally, and so it's not stacked for some. Universal design and accessibility and interoperability, making sure that we're designing these services and security of people's data. Preventing misuse of health data, so not just the positive uses of it, but also making sure that we have mechanisms in place to prevent some adverse uses of data.
Mark?
Partnership and health, yes.
Excuse me, we lost you for a minute. Could you go back, please, to universal design and then proceed? Because you went mute there for a couple of seconds.
Very good, thank you.
Thank you.
It must be that bandwidth issue. So universal design, which is sort of designing and building for the diversity of the populations we're serving, not just assuming one homogeneous population, and that's certainly the case with social determinants of health. Privacy and security, very important for all people. Preventing misuse of health data. So this is a principle that doesn't look at it as sort of the positive benefits of data, but make sure that we are building in protections against misuse of data. Partnership in health IT literacy, very important. Accountability, it's good to have principles, but let's make sure that we're actually accountable for them and that we're enforcing them. So the next slide, please. And then we just had next slide, please. We had some more specific principles about privacy and security. So I covered this in a little more detail on the last call. We invited comments from folks to Sarah and to me. Lots of very interesting comments and appreciations in the chat box on the last call. Got 3 emails. One from a person who really appreciated the principles, but was worried about whether they might then become a part of regulatory burden. And I think the answer is these are Gravity Project principles. We're using them to guide our work and our thinking, so they're not a part of regulation, although I understand the concern. Another comment was the importance of autonomy, lifting that up as a guiding principle, and much appreciate that. Sarah and I think that principle is already actually pretty well woven into the draft of these principles, both the individual benefits, making sure that we're designing for individual needs, that we're protecting against abuse of individuals' data, privacy, and security. So appreciated the comments. Think that's woven into the principles as they are. And the last comment was about the importance of privacy and security again, and we've actually added an appendix which has a whole list of fair information practice principles to boot. So with that as a summary, if I could go to the next slide, please. We edited them based on these comments and some of the comments in the chat box last time. We've dropped them into the Confluence site, and so we're just asking you again to take a look at them. Do you think these are good data principles for the Gravity Project to adopt and use going forward? If you have any comments, do feel free to email me or Sarah, and we'll come back to you with the feedback. Based on what we heard from the last call, you all are pretty excited about them, and we're looking forward to weaving this into our work as we have been. Thank you.
Thank you, Mark. I'm just handing over presenter rights to Lisa. Lynette, I'm going to just look for her.
I should be at the top, Evelyn, of the list.
Yes. There you are.
There we go. Thank you very much. And hello, everyone. This is Lisa Nelson, and I am going to be giving us a brief update on our FHIR IG, if I can figure out how to share my screen correctly.
Okay, we see it. There you go.
Thank you. This is the timeline of where we are in our roadmap of developing the SDOH FHIR IG covering food insecurity. We have taken an incremental approach for building this complex specification, and we are just at the point where we have released version 0.0.3, which I'll tell you a little bit more about today, and we have about 2 more iterations as we prepare what we hope will be clear guidance that would be able to go to ballot at HL7's, through HL7's ballot process. And an important part of confirming, I think we need to have people mute.
Ooh, can everyone make sure their devices are muted, please? I will try to mitigate that sound, Lisa. Give me just a second.
Thank you.
Monique, can you put yourself on mute? Monique? There, thank you.
All right,
okay,
we got it. Thank you. So an important part
yes, headsets create feedback. Sorry, everybody.
An important part of confirming that we've got the right guidance written down is the significant testing that's done by organizations that come to Connect-a-thon events to attempt to follow this guidance and work through the use cases and help us shape the ideas of how FHIR will be used to accomplish the Gravity use cases. So we have a few Connect-a-thon events planned between now and when the IG gets ready to go to ballot, and I'll talk more about those in a minute. I did want to remind everyone that given our timelines, our focus for this first round of IG development is on the first 2 use cases that Gravity's community has identified. That's focus on gathering the SDOH information from screening and from clinical encounters in conjunction with patient encounters, and the second use case, which focuses on referrals and tracking and documenting referrals that are done for interventions and that closed loop of being able to follow all the way through to know how the intervention turned out. The update that I'm proud to talk about today is that version 0.3 is now available. We've had an amazing team working behind the scenes to get us to the level we are right now, and I wanted to remind everyone that the easiest way to access this is through the quick links page on Gravity. I'm going to show you that again as a reminder and just briefly give you a preview of some of the highlights of the new release of the IG. So once you find your way to the Gravity space.
Lisa,
yes?
Sorry, we're not seeing it. You have to share the application.
Okie doke. Stop sharing. Share content. I'm trying to do my entire screen. How's that now, Evelyn?
Yes.
Super. Thank you very much. So once you find your way to the Gravity space in Confluence, the page tree navigation to the Gravity FHIR IG will bring you to this main page where we have a nice quick links table that gives you access to everything that you need to know. And the community review of this version 0.0.3, that link is right there. Makes it pretty sweet and easy to get to. When you click on that, the FHIR IG will open to the home page that gives you some good background information about the purpose of this IG, how to use it, aimed at different audiences that may be interested in starting to read this guide and use this guide, participate in Connect-a-thons, and then an important section called Notes to Reviewers and Balloters. And this is about 6 important messages that help you understand this iterative spot that we are at, some of the challenges that we still face, some of the things that are not yet perfect in the IG, but it just gives you a heads up on that, some areas where we're looking for specific feedback. The next page that I will highlight is the table of contents area of the guide, and I just wanted to point out here for everyone in the community, whether you consider yourself on the technical side of things or not on the technical side of things, this FHIR IG has content for you. I wanted you to note that all of the hard work that this community did on food insecurity is now poured into this IG. You can see here things that you'll recognize. There's a whole background about what Gravity Project is doing and why, background on our personas that were developed and the patient story that we've been working with, information about all of our use cases that sets the stage for what we are attempting to do for information exchange of coded data, and a nice little background chapter that just walks you through basically the different data that we are sharing and the definitions and the kinds of FHIR objects that are used to represent it. And then some more technical considerations. I wanted to highlight that in this chapter right here, you will see our master list for food insecurity. And this is the place where that Excel spreadsheet became the roadmap to coded data. And places where there are existing codes, those codes are listed. And places where there were not yet existing codes for some of the screening instruments that were identified for food insecurity, they have all been coded up through a special local temporary code system in this IG that allows us to assign temporary codes that lets implementers get started with these use cases right now so that we can prove out the concepts that are needed, and then we can rapidly work with organizations like Regent Street with LOINC and SNOMED to assure them that the concepts that have been specified are fit for purpose and we're ready to have national codes assigned. So this is an important aspect of what the FHIR IG is doing. And then for all of the technical people, this entire Chapter 3 of the IG are all of our latest and emerging profiles and examples that demonstrate how to use FHIR to accomplish what right now this IG at version 0.0.3 is focused on use case 1. So all of these are the technical artifacts that you need to understand how to use FHIR to implement use case 1. So I encourage everyone to go out, click on your quick links, have a look at this latest version of the IG, but know that we are still working on it. As the roadmap shows, we still have quite a ways to go. The next thing to talk about are these opportunities to help test the guidance that's being documented. We had a very successful initial or early Connect-a-thon experience in Sydney. I'll tell you about that a little bit more in a minute. That was back in February. We learned a lot from that experience, and we have 3 more opportunities coming up, 2 in May. They will very likely not be in San Antonio, Detroit, possibly not in Baltimore. The HL7 board is meeting first thing next week to determine if and how these Connect-a-thon experiences will be run virtually rather than in their pre-assigned locations. So this is emergent information, and we will be in touch with everyone who is following where these Connect-a-thon opportunities are. We do believe that if this opens up as a virtual experience, that even more of you may decide to try and participate, and we're encouraging folks to be thinking about that. The dates will likely remain the same. We'll be in touch. Our community-oriented Interopathon in Michigan will be following a similar pattern, and we also will be getting more information about that on Monday so that we'll be able to keep you guys updated on how that's coming together. The main point for all things Connect-a-thon related is this Connect-a-thon link right here off from the Gravity page as well. It takes you to a place where you can sign up, and I'll show you that in one second. I wanted to mention that because of our short amount of time today, I did not have the opportunity to give you a demo of the use case 1 implementer experience that was demonstrated in Sydney, but I encourage you to get this presentation and go to this YouTube link and watch the recording of the last Connectathon session where I demonstrated it. You can see the hunger vital signs screening used in use case 1 to be kicked off, answered by a patient through a mobile app, shared back with the EHR where that task to do the screening was initiated, subsequently updated with some clinical judgment about what that screening information means, along with interacting with a patient during an encounter, being able to record conditions and to put a diagnosis or an issue on a patient's health concerns list or problem list, identifying goals, and then ultimately recording and tracking interventions. So we have a good start at it, and this I think you'll find this demonstration interesting, so give that a look. Our next steps include our planning for use case 2 to get documenting with that. And my guidance for folks who are thinking about referrals right now and closed loop referrals, the Gravity Project is reusing implementation guidance that has already been developed in an IG that is called Bidirectional Service Request, BSER. It's available on the FHIR Implementation Guide Registry. And for anyone who's trying to get a jump start on anything that has to do with using FHIR's service request patterns to do referrals and messaging to monitor over closed loop referrals, your best guidance right now is to consider what has already been demonstrated and documented in the BSER IG. Our Connectathon planning calls are listed here on the bottom of this slide. We meet on Wednesdays from 3 to 4 o'clock p.m. East Coast. We have an upcoming meeting on March 25th and then 3 more in April as we prepare for those first May Connectathons. I encourage you to consider what technical roles your systems might like to attempt to play. Sign up to let us know that you're interested in being involved, and we'll make sure you're getting all the right information. And then plan on attending these prep sessions. The login information is also available on Confluence. And if you're just getting started with reading the FHIR IG, it's also a great place. We will have more information and updates for you as we get a little bit further along with documenting use case 2 here in the Gravity community meetings. But if you'd like to spend more time talking about the IG, these meetings right here are the best place to come and find the technical folks gathered. Back to you, Evelyn.
Okay, just give me a second to take presenter right. Lynette, you might have to hand them back to me.
Yes, I'm on it. Yeah. Give me just a second. Okay, hang on. Let's try this a different way. Please hold.
This is Sarah DeSilva here. I've been doing my best to try and answer questions in the chat box, but if anybody wants to raise their hand, we can try to see if we can answer more questions while we're transitioning presenters.
Actually, this is a pause for questions, so we can open it up. We have 1 or 2 minutes before our next step is just going through homework.
Hi, may I ask a quick question? This is Michael Cox from New Wave.
Yes, please go ahead, Michael.
When Lisa was reviewing the master list of coding, I just wanted to confirm, I just downloaded the new master and temporary code list version 0.0.3. Now those temporary codings are going to be the same as that shorter list of just the food insecurity ones, correct?
Yes, they are. They're only right now. The master list only has food insecurity concepts in them, and that list has a mixture of existing codes and temporary codes. You can use the temporary codes for testing the IG, but it's our intention that before we publish, we will be working with the code system SDOs to make sure that concepts that prove out as needed will have official LOINC and SNOMED and ICD-10, et cetera, codes associated with them.
Great, thank you so much. Yeah, I was concerned about using temporary codes. I remember in a previous video you said that we'd be working with the vendors to get the correct coding. Just to tie into that, I know that you've pointed to the NLM form builder, and there's also a library used for creating those questionnaires in a web form. I think, as far as I know from using it, the NLM library is only integratable with the LOINC codes, not SNOMED or ICD-10. So is LOINC the priority for everybody
LOINC
else?
Yes, LOINC would be the primary code system that would be used for these screenings. So the tab that identifies all the questions and answers that Sarah and Linda developed working with the community, those will eventually all be LOINC codes. When they're already in LOINC, if you make an attempt to use the LHC form builder tool that is also linked to from the IG, then when LOINC panels have been established, you can give that form builder the panel code, and it's pretty smart about developing the set of questions for you automatically. It makes developing the questionnaire resource very easy. But the tool also supports just kind of think of it as like a Survey Monkey kind of interface where you can be developing questionnaires and you can use those temporary codes and questions that have been identified to create questionnaires yourself with that, and then use that questionnaire resource to drive a request to have patients screened for whichever questionnaire you develop.
Yep, and that's what we've been following so far. So thanks for confirming, making sure that we know what we're doing is correct. I will say, and this is for everybody else listening, that there also is a library out there for hosting them as a web form. It's under the same Lister NLM project.
Thanks, Michael. I will put that in the chat also. I'll send so folks who are interested in what we're talking about, I'll put the link to the LHC form builder.
Thanks, Lisa and Michael. Thank you very much. And Michael, thank you for bringing up coding systems, because we do have a resource that I will show you the link for in just a moment if you need to know more about the coding systems and how they're being used in our Gravity project work. For your next steps and your homework, we would like for all of you to submit data element concepts for housing as you are able. Like we said, we will be pushing out the due date. We don't know when yet, but bear with us and we will keep you updated. But if you're able, between now and April 3rd, feel free to go ahead and submit. And like Linda said, we will take it piecemeal. We'll take it however we can get it. You can go to the Confluence for instructions on how to do that. And if you have questions, please email us at gravityproject@emiadvisors.net. Next slide, please. If you want to get involved with the HMIS work, you can email Sarah DeSilvi, and she will be happy to respond and let you know what you need to do to participate in that. And if you have thoughts on the updated draft data principles for Gravity, you can email Mark or Sarah, either one. Those are posted on the Confluence, and you can download that document and read the full draft data principles document and comment on it. Next slide, please. If you need more information on the coding systems, we have brief overview videos of each one. The links to those, they're YouTube videos, but the links are posted on Confluence as well on our instructional materials page. Next slide, please. And if you want to sign up for 2020 Connect-a-thon events, or if you're interested in participating in the Connect-a-thon meetings, like Lisa said, please do go to the Confluence, or you can email gravityproject@emiadvisors.com and we can put you in touch with the FHIR IG team. And if you have not already done so and you wish to receive email updates from us and a correct calendar invitation, please join the Gravity Project as either a committed member or an other interested party. There is no charge, there is no real commitment. It's just a way for us to track your level of participation and be able to reach out to you on our distribution list. Next slide, please. And with this, we have about 30 seconds for any last minute questions, and then we will adjourn. Are there any last thoughts? All right, well, we appreciate all of you being on. We will be in touch, and please stay safe and healthy. We appreciate you all. Thank you very much.
Thank you, everyone.